Welcome to This Explainer. Today, we're diving right into a really profound question. How exactly do we handle the delicate, everyday care of our most vulnerable, immobile seniors? You know, when a loved one or a patient becomes bedridden or chairbound, their needs change drastically, almost overnight. We have to adapt. So let's jump right into this. We're going to look at a highly structured approach that takes some pretty overwhelming medical advice and transforms it into totally actionable daily care.
It's the fundamental challenge, isn't it? As the human body ages, and especially when immobility enters the picture, it faces some seriously unique and compounding vulnerabilities. We see rapid, severe muscle loss. We see a really dangerous drop in the natural sense of thirst. Even things like stomach acid and saliva production slow way down, completely changing how food is digested and even how it tastes. So the big takeaway right off the bat is that we absolutely cannot just apply standard adult care to bedridden seniors. We need specialized strategies to protect their health and, honestly, to protect their dignity.
To make sense of all this, we've broken the source material down into 4 core pillars of care: nutrition, hydration, oral hygiene, and physical monitoring. Let's get right to it with Pillar 1. Pillar 1 is nutrition, specifically focusing on soft and protein-rich foods. For older, immobile adults, getting tailored nutrition isn't just about staving off hunger, it is quite literally a vital medical intervention.
You've probably heard of sarcopenia, right? It's that progressive loss of muscle mass that naturally starts in our 30s, but it really kicks into overdrive after age 60. Now, when a senior is bedbound, this muscle degradation is basically supercharged. If they aren't getting enough protein, their body just accelerates the destruction of muscle tissue, paving the way for a total loss of functional capacity. This is exactly why high-quality protein has to be the absolute cornerstone of a bedridden patient's diet.
But how do we actually deliver that protein? A standard adult diet relies heavily on things like red meat or hearty, raw grains. But for seniors, remember, stomach acid drops and digestion slows way down. A steak suddenly becomes incredibly difficult to digest. Instead, a bedridden diet has to pivot to easily digestible, soft proteins. We're talking bone broths made from slow-boiling chicken and veggies, soft rice porridge, and really finely pureed foods. It's all about delivering maximum nutrition with the absolute minimum amount of digestive strain.
But hey, caregivers inevitably hit a wall at some point: the total loss of appetite. What do you do when a patient is only eating a few bites? Well, the sources make it clear that we have to enrich those tiny portions to prevent malnutrition. If they're eating less volume, every single bite has to pack a punch. You can quietly bump up the caloric density of their meals by mixing in things like high-quality vegetable oils, think flaxseed oil, or nut purees, soaked dried fruits, and high-fat dairy. It's a brilliant way to meet their energy needs without forcing them to stare down a massive plate of food.
All right, moving right along to Pillar 2, hydration strategies. This is often the hidden danger in senior care, mostly because we're just so used to expecting people to drink when they're thirsty.
But with seniors, that biological alarm bell kind of stops ringing. Because they lose their sense of thirst, they won't always ask for a glass of water. So as a caregiver, you've got to play detective and actively watch for the subtle warning signs. We're talking a dry or sticky mouth, dark urine, or reduced skin elasticity. But you also need to pay close attention to sudden fatigue or unexpected confusion. Sometimes what looks like a cognitive decline or a sudden spike in heart rate isn't a brand new disease at all, it's just severe dehydration.
So how do we fix this without forcing them to chug giant glasses of water? The goal is roughly 1,500 milliliters of fluid a day. First up, just offer frequent, small sips throughout the day. Second, keep in mind that we humans get a ton of our water from our food, so serve hydrating options like soups, yogurts, watermelon, and cucumber. And third, keep their room cool, especially during the summer, so you prevent that invisible fluid loss through sweating. Now let's transition into Pillar 3, oral hygiene for the bedridden. It's incredibly easy to overlook dental care when you're overwhelmed by mobility and diet issues, but ignoring it can trigger a complete cascade of health failures.
As we age, saliva production takes a nosedive, and without the natural cleaning and moisturizing effect of saliva, the mouth turns into a breeding ground for bacterial plaque and fungal infections. But here is the truly fascinating and honestly dangerous part. Dry mouth actually alters the taste buds. When seniors can't taste their food properly, they start craving wild amounts of salt and sugar just to get any flavor at all. This completely derails their systemic health, aggravating things like high blood pressure and diabetes. It is a crazy biological chain reaction that you really have to watch out for.
And for the huge number of seniors using prosthetics, there are some very strict rules to follow. Dentures absolutely must come out at night, no exceptions. The gums underneath literally need to breathe and rest. Once they're out, clean them with a special brush and soak them in cold water. Maybe throwing in a purifying tablet now and then. Leaving them in around the clock ruins their fit over time and practically invites painful mouth ulcers. Finally, we hit pillar 4, physical monitoring. This is the big one. This is where nutrition, hydration, and immobility all physically intersect right there on the patient's body. To keep a clinical eye on things, the medical community relies on tools like the ESPN Mini Nutritional Assessment, or MNA. We've distilled those screening criteria into a super practical checklist of red flags for you. If a patient drops more than 3 kilograms in 3 months, if they are entirely bed or chair-bound, or if you spot even the very beginnings of a pressure sore, those are high-risk indicators. Immobility mixed with malnutrition is basically a fast track to developing severe skin ulcers.
The crucial takeaway here is that careful everyday observation is your absolute greatest defense. You literally cannot put senior care on autopilot. You've got to check their skin integrity every single day. You have to track their weight. You need to notice exactly how much food is actually making it down. By catching a tiny drop in appetite or just a slight reddening of the skin super early, you are preventing massive, life-threatening complications down the line.
As we wrap up this explainer, I really want to leave you with this final thought. Routine care is about so much more than mere survival. It's about preserving a patient's dignity and their quality of life through every single sip and every single meal. By bringing together these 4 pillars, soft, protein-packed food, smart hydration, diligent oral care, and hypervigilant physical monitoring, you aren't just keeping a person alive, you are actively protecting their humanity. Which really makes you wonder, as our global population ages faster than ever before in history, is our society truly prepared to step up and provide this level of intricate, dignified care? Thanks for joining us, and we'll catch you next time.